In the battle against an insidious and deadly disease, members of the disabled community are among the most vulnerable. As COVID-19 marches relentlessly on, many are feeling overlooked by the government in areas like access to education and testing. What advocates say is a lack of planning on the part of the government has left many wondering, does anybody care?
People with disabilities in Ontario, numbering over 2.5 million, are facing really a triple whammy during this COVID crisis beyond what everybody else is facing. Everybody's facing a crisis, but this is even worse. The first is that they are disproportionately prone, any number of them, to getting this disease and to getting its most severe medical impacts. The second is that a combination of government neglect and failure to plan is making them, or any number of them, even more prone to get the disease.
Advocate David Lepofsky has many concerns. One of them relates to the basic need for coronavirus testing. For many in the disabled community, there are barriers just to get to testing sites. The government should be making home testing possible, Lepofsky says, and that's something the official opposition is also calling for.
They're worried and concerned that they've been left behind. I mean, there's really no plan to ensure that they get tested if they start showing symptoms. They have some real concerns about access to the testing that everybody else is able to get. And so we've asked the government to put in place a plan to have a testing available for those folks. And that would include ensuring that they can get tested at home.
Ontario's Minister of Health was asked about this issue today and said the government is willing to accommodate everybody.
If people need to be tested, we can take the testing to them, especially people with disabilities who maybe have significant mobility challenges. We want to make sure if they need to be tested, that they will be tested.
But that's not the only concern facing the disabled community, says David Lepofsky. He says hundreds of thousands of kids with disabilities are falling through the cracks in the government's efforts to implement online learning, which he says is not accessible to many of those students. He also says disabled people living at home but who need assistance are left without support, something the head of the Centre for Independent Living in Toronto wholeheartedly agrees with.
The folks that we work with have not been considered a priority in any of the priority populations that we've seen defined.
Wendy Porch manages a program for about 1,000 Ontarians who live independently but need assistance with daily tasks such as eating, getting washed and dressed. They have not been receiving any government assistance providing attendance with protective equipment such as masks, in spite of being essential workers with close physical contact with clients.
They see the same PSWs that work in long-term care facilities and in cluster care facilities, and they're certainly at risk. But because they're at home, it seems as though they've fallen through the cracks here.
One of David Lepofsky's biggest concerns has been around what he calls the government's secret plan to prioritize patients should critical equipment such as respirators fall into short supply and decisions have to be made about who gets care and who doesn't. The government has tried to reassure members of the disabled community, stating in an open letter that no human life is valued differently. Lepofsky says that's a step in the right direction. I'm Pam Seatle, City News.